to cut out or MIP the 3D time of flight MRA of the head. So I select it here, and then you go over here. There's all kinds of different functions that you can use. You want to pick IBI. And when you click on that, you're going to get 4 windows, like so. So this is a 3D model of Chad's arteries and Chad's head. As you can see here, this is the circle of Willis. The circle of Willis is right in this area right here. So you can actually see on Chad has an excellent brain for this, because you can see the internal carotids coming in here. You can see them, the bifurcation is right in this area here. You get anterior cerebral, middle cerebral artery right here. You have the vertebrals coming in here and here. The basilar becoming the posterior cerebrals coming around here and here. And you can even see his 2 posterior communicating arteries. There's one right there, you can barely see it. And then there's one on this side. So you have 2 posterior communicating arteries. You have 1 anterior communicating artery, but you can never see it because it's the 2 anterior cerebral arteries kind of come together from the left and the right side, and they just kind of turn into a mess right here. But in that mess, there should be a communicating artery between those 2, creating a circle right there. So if one of these arteries gets blocked, then blood is shunted from another artery to keep a stroke from happening. That's the reason for that. That's the design feature of the human brain. So, but not everybody has these. Some people are born without communicating arteries. All right, so these are the controls that we have, and the controls also appear in here. You have controls showing up all over the various places. I'm going to show you how to do it my way. Now, there are 2 ways of cutting out brains. There's a way of cutting out brains where you cut out every little angle and you cut around all the vessels to try to get as close to the vessel as you can as you cut it out. I don't tend to do that. Where I trained, the radiologist wanted to see more of what they call the territories, which is more of the areas around where the arteries are, looking for anomalies like AVMs and that sort of thing. So I'm much more interested in just getting rid of, you see this darker gray stuff, I'm going to try to leave that as much as possible, and I'm just going to try to get rid of all this white, brighter signal here, the signal in the orbits and stuff like that. So to do that, you go to the scissors. Now the scissors are your cutting tool, and I'm going to go around the brain. I'm going to start, you can start anywhere obviously, but I usually start up at the top and I cut out an orbit. You see that V shape? I just cut out the orbit where all that fat is, and then I very carefully go around the edges of the skull, making sure that I don't cut into any of the vessels inside the brain. Like this is inside in the brain. These here are actually in the scalp, so I can cut those out with impunity. But I just go basically around the skull, and then I come to this orbit and I cut in and back around like that. So I've created basically a circle with 2 notches taken out of it where the orbits are. So what I want to do is, you have 2 options. You can cut inside or you can cut outside. I want to cut the stuff outside that green area, not the stuff inside. So I click on that, and I've gotten rid of like 60 or 70% of what I need to get rid of right there. Cleaned it up quite a bit. Now that I've done that, I like to go to a different projection to cut out some more. So I look at it from the right side. Now, anything that's anterior of this vessel here, which is the internal carotids coming in, I can get rid of. All this face stuff here, I can get rid of. And so what I'll do is I'll come down here, I'm going to hug the skull like this, but I'm going to cut in and I'm going to get rid of all the arteries to the face. I also, these are the vertebrals coming in over here. I don't need that. That's going to the scalp. And so I cut that out too. And I come around like this. All right. So now that I've done that, I go to the anterior view, and I can see the vessels, the intracranial vessels right here. I can get rid of this vessel. I can get rid of a lot of this stuff around the edges. So I do that. So I go through and I try to give the intracranial vessels some room. I don't want to clip those. but I cut out sort of like this. Boom. And cut outside. Now I turn it 45 degrees each direction. So I go like this. Again, I'm trying to get rid of a lot of this extraneous signal and this stuff over here. And you see how it separates these vessels that I want from the anatomy that I don't need. So I just go through and cut around here. I don't know what that is, so I'm going to cut that out there. And cut around here. And around there. Then I turn it 45 degrees the other way. And I do approximately the same thing. Just around this way, cut this vessel out, through here, back around here, cut that. I refer to it as schmutz. That's just schmutz, you get rid of the schmutz. And so I cut outside again. Now, I'm pretty close, so if I go back to the inferior view, you can see how I've gotten rid of 95 or more % of all that gray signal, and all I'm left is a very, very dark background. Does everybody see that? All right. So, now I'm going to very carefully try to cut, without cutting into these vessels here, cut out the rest of the skull on both sides. This little chunk of skull usually gets left over, so I get rid of it. Like so. And then if I want to be extra, I can tip the brain one way or the other, looking for any extraneous signal. This looks really clean to me right here. If I go to the other side, I've got some weirdness on this side, so I'm just going to cut the weirdness off right here. So that edge of the brain is nice and clean, right like that. I'm a little close right here. You see that little vessel there? I don't think the radiologists care about it, but because I'm close, I'm just going to knock off that cut just a little bit, just to give myself a little bit more room. So, and I'm going to cut, this time I'm going to cut inside, because if I cut outside, I'm going to cut the brain off, and I don't want to do that. So I just trim that off. So this is pretty much a very well cut out brain, all right? Again, I've left a lot of the territories around here. I can go in and cut in every little edge here and around every little vessel. Takes a little bit more time, but I find that it's distracting for the doctor because you've got all those little cuts, and whereas this, you can see the anatomy really well. So the first thing I'm going to do is cut and rotate around the whole brain from basically this view to the opposite direction. So to do that, you have this icon right here, which allows me to do the spinning. This icon represents the direction that you're going to spin the anatomy in. So if I hit this one, it's going to tumble like this. If I hit this one, it's going to tumble like that. Okay? So it gives you the directionality of how you're going to do it. Your parameters are here. I tend not to use this. I use the loop function because it gets rid of, if you're in rotate, you have this thing on the screen when you do your MIPing, and I don't really like it there, so I use the loop function. The loop function is a little different. It allows you to select a starting state and an ending state. So I'm going to start with it with the brain rotated so that the nose is pointed down. I'm going to go hit start. I'm going to go to I, which means the nose is pointed up, and then I hit end. And you get to choose the number of images that you want. I choose 36, which means it gives you one image about every 5 degrees or so. All right? So that's pretty much that. And then all you have to do is click OK, and it'll do it. Now it asks you to name the sequence. You don't really have to. And it's processing it out. It doesn't show it to you. At Tempe, you can actually literally watch it move as it's processing. But if you're concerned, you can come back here and you can go to your projection images, and you can go to your viewer. If you didn't think you did it right, see how it spins around like that.
That's cool.
So it's a 3D view. You get a really nice view of the posterior communicating arteries there. You can see the vessels turn out very nicely. it's a pretty nice looking scan. We do have an interesting thing here where we have this, there's a gradient, there's more signal here than there is, and so the third slab seems to have more signal than the second. That's common, that happens quite a bit. It's called signal dropout, and you'll see that. You'll especially see it in this right here. Do you see let me see if I can, I'll show you on another image. See how the vessel comes in here and it does this little spiral thing? You can quite often get signal dropout right there because the spins are tumbling in that tube. So anyway, so I just show you that so you just know that you're doing it right, even though you can't really tell. All right, so back to this IVI thing that I'm doing. So now that I've done the whole brain, I'm going to start cutting out the individual areas, the territories. So what I'm going to do is I'm going to tip this forward. I need to separate this internal carotid artery here from this posterior cerebral artery right there. Do you see how tight that is? How you wouldn't be able to get a cursor through that very easily? And sometimes it's even worse. Sometimes they overlap. They're literally over on top of each other like that in some brains. But if you tip the brain forward, you're going to open up that space a little bit, making it easier to get a cursor through there. Okay? So I'm going to go back to the scissors, and I'm just going to circle the right circulation. Sort of like this. Come through here. So I've included basically the right internal carotid, right middle cerebral, right anterior cerebral. Okay? Now, when you do this, it doesn't matter which one you do first, whether you do right or left, but you need to do it always the same way every time. Because if you do it one way one time and you do it the other way the next time, you're going to get confused and you're going to cut the same one twice, especially if you're trying to scan a patient, you've got other things going on, it gets so that distracting. So you have to be able to do the same thing always the same way over and over again, so you never make a mistake and spin the same side twice or something like that. It's a mistake that you don't want to make. So now that I've circled the right circulation, I click cut outside. All right. So this is just the right side. Now what I like to do is I right click and I go center on object, which puts the object right in the middle. And then I just, we'll go around and cut out once, just some of this extraneous areas where the brain really doesn't exist, something like that. I leave most of the territory alone. I cut outside, so I trim it up a little bit. You can also go to the anterior view if you want to. You see some of this stuff right here you can get rid of because it's not really part of the brain. This is like the petrous bone in here, and you know what I'm saying, there's no real anatomy there. And then cut outside. So I like it. This is the bifurcation right here. So this is the internal carotid, this is the anterior cerebral, this is the middle cerebral. If you're going to have an aneurysm, it's going to be right there. That's where 90% of berry aneurysms occur. So that's why the radiologists really want to see that little spot. It's very important to them. All right? So I'm going to go to the right side, and now I have to identify it because this looks a lot like the left. I have to stick an identifier so I can put right anterior circulation. You can't do this without identifying which side it is because the radiologist won't be able to tell if it's the left or the right side. Okay? So now that I've done that, same thing as before, start, go to the left side, hit end, and then type 36 again. And then I hit OK. It's going to come up with this box. I just click OK, and it's going to spin it in the background. Next thing I want to do is get rid of this right, go back to the inferior view, go back to the cutout, and then I want to undo. Now this has multiple undos on the scanner. Temp B, you actually have to, when you finish cutting it out, you have to save it. If you don't save it and you cut out the right side, you're going to have to cut out from the beginning again because it only allows for one undo state. This I think has like 30, so you can keep undoing until you get back to the original state where you were. You can also, if you move the cursor to the edge of the screen, you'll see it say roam image, and then you can move the brain around wherever you want it into the center. Same thing as before, I'm going to tip the brain forward a little bit. I also need to get through right here, so I might actually angle it just a little bit that way to buy myself a little bit of extra space in there. Okay? And then I just go ahead and circle around again. Cut gently right through there, come right through there, cut right through that PCOM perfectly. Get rid of that, whatever that is. And now, if I think I'm a little too close, I think I did a good job, I can nudge this, but I don't think, the last thing you want to do is cut into this vessel right there, because it may look like plaque to the radiologist. So you don't want to do that. And then I go back to the right view. I usually just trim this up just a little bit. All right, and again, there are some technologists that would come in here and they would cut like this, and they'd cut around here, and they'd cut over here, and they'd cut this out here like this, and they'd go around here like this, and around there, and you know, they would literally do this. But I want to show you the difference here. If I go through around each little like this, and then if I go to the anterior and I do the same thing, I can just trim right up in here, go around here. Pituitary lives right there, and like that, and then you can come right into here. Right around like this. I think I've seen Dave do this, Dave Diffenderfer, and all right, so when I spin this, do you see how distracting that beige stuff becomes of all the little, you know, to me, it's harder to see the vessels than it is that other way with just like the gray surrounding them even, you know? So this just to me is just weird looking, but I have seen a bunch of technologists do it this way. So, and I'm not sure how Bill's going to teach you. So there are those two methods of thinking. I prefer my way, but I'm not going to tell another technologist not to do it their way, all right? So, but I am going to undo all that cutting that I just did. Now I'm just going to just generally go around here just to get rid of some of that signal that's not in any territory of the brain like that. All right, so this is boring, isn't it? So believe me, it's one of the more boring things we do. All right, next thing I have to do is identify it. We're looking at the left side now. So left anterior circulation, boom. Good. All right, and then I come back here. I start it, left, end, and then 36. Click OK, and OK. All right, we're in the home stretch, which is good because I'm getting bored of it already. So I go back here. And I want to undo a bunch until I get the posterior circulation. Now I just want to cut out the posterior circulation. So I tip it way forward, so I've got good space in here, and I just circle the posterior circulation like this. And then again, I just try to go, I don't get too close to it, but I kind of go around like this. Just get rid of any extraneous. I center it up. Now, I've seen people say put posterior circulation on this, but you're not identifying left side from right side, so I don't generally. If a doctor doesn't know what they're looking at, they don't deserve to be looking at the image, you know. But there are some people, you can go here and put posterior circulation on it right there if you wanted to, just like that. All right, so I'm going to start this, go to the left side, end it, and then type in 36. Hit OK, and then OK. And now I want to go from superior start set to inferior end set, and then 36 again. And click OK, and then OK. And that's it, you're done. So that's the method of cutting out a brain.